Carcinoid tumors is an neuroendocrine tumors. Look at this picture shows that carcinoid tumors in lungs. Then CT findings, MRI. Look at this. And PET scan findings. Look at this. Detail going on. Introduction. Carcinoid tumor are a type of neuroendocrine tumor that arise from enterochromaffin cells, which are part of the neuroendocrine system. These tumors most commonly occur in the gastrointestinal tract and lungs, though they can also be found in the pancreas, liver, and other organs. They are generally slow growing but can metastasis and cause significant complications if not managed properly. A definition: carcinoid tumors are rare, slow growing neoplasms that originate from neuroendocrine cells. These cells have properties of both nerve and hormone producing cells, allowing the tumor to secrete hormones such as serotonin, histamine, and bradykinin, which can lead to carcinoid syndrome in some cases. Etymology: the word carcinoid comes from the Greek word carcinos, meaning crab or cancer, and oid, meaning resembling, coined in 1907 by Oberon Dorifer to describe tumors that appeared less malignant than typical carcinomas. Over time, the term has been used to classify slow growing neuroendocrine tumors, primarily found in the gastrointestinal tract and lungs. Types Types of carcinoid tumors. Carcinoid tumors are classified based on their location. 1. Gastrointestinal carcinoid tumor, found in the stomach, small intestine, colon, and rectum. 2. Pulmonary or lung carcinoid tumors, found in the lungs. 3. Pancreatic carcinoid tumors, less common but occurred in the pancreas. 4. Other sites, rarely found in the ovaries, testes, and liver. Causes. The exact cause of carcinoid tumors is unknown, but genetic mutations and environmental factors may contribute to their development. 1. Genetic mutations. Example MEN1, DAXS, ATRX, TP53. 2. Chronic inflammation. Example atrophic gastritis, Sullinger's Ellison syndrome. 3. Environmental factors. Smoking, radiation exposure. 4. Hormonal influences. Excess gastrin secretion. 5. Unknown idiopathic causes. Risk factors. Several factors may increase the risk of developing carcinoid tumors, including 1. Family history of multiple endocrine neoplasia type 1. 2. Smoking and excessive alcohol consumption. 3. Chronic inflammation of the digestive tract. 4. Older age. Most cases occur in people over 50. 5. High fat diet. Complications. Carcinoid tumors can lead to several complications, including 1. Carcinoid syndrome caused by excessive hormone secretion, leading to symptoms such as flushing, diarrhea, wheezing, and heart palpitations. 2. Metastasis, spread of the tumor to the liver and the other organs. 3. Heart valve disease, resulting from prolonged exposure to serotonin. 4. Bowel obstruction due to tumor growth in the intestines. Pathophysiology. Carcinoid tumors are a type of neuroendocrine tumor that arise from enterochromaffine cells, which are part of the diffuse neuroendocrine system. These tumors commonly originate in the gastrointestinal GI tract, especially the small intestine and appendix, and the lungs. Below is the step-by-step pathophysiology of carcinoid tumors. 1. Origin and cellular mutations. 2. Uncontrolled cellular proliferation. 3. Tumor growth and local effects. 4. Hormone secretion and systemic effects. 5. Liver metabolism and carcinoid syndrome development. Normally, hormones secreted by carcinoid tumors are metabolized in the liver and do not cause systemic symptoms. However, if the tumor metabolizes to the liver or bypasses hepatic metabolism, example lung carcinoids, excess hormones enter systemic circulation leading to carcinoid syndrome, flushing, diarrhea, wheezing, right side heart fibrosis. 6. Carcinoid heart disease, fibrosis development, chronic exposure to serotonin and other vasoactive substances lead to endocardial fibrosis, mainly affecting the right side heart valves, tricuspid, and pulmonary. Tricuspid regurgitation and pulmonary stenosis can occur. 7. Metastasis and advanced disease. Hematogenous spread to the liver, lungs, bones, or lymph nodes. Liver metastasis exacerbate symptoms due to direct hormone release to circulation. 8. Late stage complications. Severe malnutrition due to persistent diarrhea and malabsorption. Carcinoid crisis, life threatening, triggered by stress or anesthesia, leading to severe flushing, hypotension, and bronchospasm. Understanding these steps helps in diagnosing and managing carcinoid tumors effectively. Signs and symptoms. Symptoms depends on the tumor's location and hormone secretion levels. 1. General symptoms: fatigue, weight loss, abdominal pain. 3. Carcinoid syndrome symptoms: flushing, diarrhea, wheezing, rapid heartbeat. 4. GI symptoms: nausea, vomiting, bloating, bowel obstruction. 5. Lung symptoms: persistent cough, wheezing, chest pain. A diagnosis: carcinoid tumors are diagnosed using several methods. 1. Blood and urine test measure serotonin levels and its metabolite. 5. HYGIENE. 2. Imaging test CT scan, MRI, and PET scan to locate the tumor. 3. Endoscopy and biopsy for a direct visualization and tissue sampling. 4. Octreotide scan uses radio labeled somatostatin analogs to detect neuroendocrine tumors. Nursing diagnosis: 1. Acute pain related to tumor growth and metastasis. 2. Anxiety related to disease diagnosis and prognosis. 3. Imbalanced nutrition less than body requirements related to nausea and diarrhea. 4. Impaired gas exchange related to pulmonary carcinoid tumor. 5. Risk for deficient fluid volume related to diarrhea and processing. Medical management: 1. Surgical resection, the primary treatment if the tumor is localized. 2. Medications, drugs. 3. Somatostatin analogs reduce hormone secretion. 4. Chemotherapy used for aggressive or metastatic tumors. 5. Targeted therapy, everolimus for advanced cases. 6. Interferon therapy to boost the immune response. 7. Radiation therapy for inoperable tumors or metastasis. Nursing management: 1. Monitor and manage symptoms of carcinoid syndrome. To provide direct counseling to avoid trigger foods, spicy food, alcohol. 3. Educate patients about medications adherence. 4. Encourage fluid intake to prevent dehydration. 5. Support emotional well-being and provide psychological counseling if needed. Treatment options: 1. Surgery, tumor removal if localized. 2. Medications, somatostatin analogs to control hormone secretion. 3. Radiation therapy for inoperable tumors. 4. Liver directed therapy, radiofrequency ablation or embolization for liver metastasis. 5. Targeted therapy and chemotherapy for advanced stages. Psychosocial medicine: 1. Patient education, informing about disease progression and management. 2. Support groups, connecting patients with others facing similar challenges. 3. Counseling services, assisting in coping with emotional distress. 4. Family involvement, encouraging a support system for emotional well-being. 5. Mindfulness and stress reduction techniques. Yoga, meditation, and relaxation therapies. Prevention. 1. Maintain a healthy diet rich in fruits and vegetables and fiber. 2. Avoid smoking and excessive alcohol consumption. 3. Regular medical checkups for high risk individuals. 4. Genetic counseling for those with a family history of neuroendocrine tumors. In counseling, carcinoid tumors, though slow growing, can significantly impact health. If left undiagnosed or untreated, early detection through screening, imaging, and biomarkers can help manage symptoms effectively. A multidisciplinary approach involving medical, surgical, and nursing care ensure optimal patient outcomes. With advancements in treatment options and supportive care, patients can achieve better quality of life and improved survival rates. Thank you. Have a nice day.